Every single day, more than 1,000 older adults end up in emergency rooms, not because of accidents, but because of medications they thought were protecting them. In this video, we're going to count down the 7 everyday pills that can quietly weaken the heart. Some of them sit right in your kitchen cabinet or nightstand. Others are prescribed so often that people assume they're completely safe. But the reality is very different. And knowing the truth could literally save years of your life. Stay with me until the very end, because pill number 1 is the one most doctors still prescribe without realizing how much damage it can cause. And if you miss it, you'll miss the single most important step you can take to protect your heart. I'm Dr. Eli Morgan. For over 3 decades, I've worked with patients struggling with hidden drug side effects. Today, I want to guide you through what I've learned so you can recognize the risks early, protect your health, and keep your independence for as long as possible. Pill number 7, common painkillers, NSAIDs. When most people feel a headache or sore knees, the first instinct is to grab an over-the-counter pain reliever. Pill number 7 is that exact group, non-steroidal anti-inflammatory drugs, or NSAIDs. You know them by names like ibuprofen, naproxen, or diclofenac. Take the story of Mrs. Alvarez, a retired teacher in her late 60s. She took these pills daily for arthritis pain, believing they were harmless. Within months, she developed swollen ankles and constant fatigue. What was happening inside her body was far more serious than she realized. Here's why. NSAIDs don't just reduce pain. They also constrict blood vessels and strain the kidneys, which in turn raises blood pressure. For a healthy 25-year-old, that might not be a disaster, but in older adults, the chain reaction can silently lead to heart failure. Recent studies even show that consistent NSAID use doubles the likelihood of hospitalization for cardiac issues in seniors. That doesn't mean you can never use them. Short courses at the right dose can be fine, but long-term reliance is a dangerous trap. If you or someone in your family is using these daily, bring it up with a doctor. There are safer pain management strategies that don't stress the heart. So now let's move on. Pill number 6 is one that millions of people with diabetes depend on every single day. Pill number 6. Certain diabetes medications, thiazolidinediones. Pill number 6 is a class of diabetes drugs known as thiazolidinediones, often shortened to TZDs. These include medications like pioglitazone and rosiglitazone. They're designed to make the body more sensitive to insulin, which sounds like a smart solution. But for many older adults, the side effects can quietly outweigh the benefits. Consider Mr. Hahn, a 72-year-old living with type 2 diabetes. He noticed his shoes no longer fit because of swelling in his legs. What seemed like a minor nuisance was actually a warning sign. His heart was being overloaded with extra fluid. Here's what happens. TZDs cause the body to retain water and salt. That added volume forces the heart to pump harder, eventually leading to fluid buildup in the lungs and ankles. In people already at risk, this can trigger congestive heart failure, sometimes without any chest pain to warn you. Research has shown that seniors using these drugs have significantly higher rates of hospitalization for heart complications. If you or a loved one is on this medication, don't panic, but do ask your doctor whether a different treatment plan might work better. Now let's move to pill number 5, a type many older adults reach for when they just want a peaceful night's sleep. Pill number 5, sleeping pills, sedative hypnotics. Pill number 5 is one that promises rest but often delivers hidden danger. Sleeping pills. These include benzodiazepines such as temazepam and Z drugs like zolpidem. They're commonly prescribed to older adults struggling with insomnia. Think about Mrs. Patel, a 70-year-old grandmother who just wanted a full night's sleep. At first, the pills seemed like a miracle. But weeks later, Her daughter noticed she was groggy during the day and had stumbled twice in the hallway. What was happening was more than simple drowsiness. These medications slow down the central nervous system. While that makes it easier to fall asleep, it also suppresses breathing, especially in people with undiagnosed sleep apnea. On top of that, reaction times become slower, which raises the risk of falls and fractures. For the heart, the lack of oxygen during sleep combined with the sedative effect can create a perfect storm that leads to irregular rhythms or even sudden hospitalization. The real danger? Many people stay on these pills for months or years, even though they were only meant for short-term use. If sleep is a challenge, ask your doctor about safer, non-drug approaches, from cognitive behavioral therapy to natural sleep hygiene routines. And now, let's turn to pill number 4. An older type of antidepressant that most people don't realize can directly disturb the heart's electrical system. Pill number 4, tricyclic antidepressants. Pill number 4 is a group of older antidepressants called tricyclics. Names like amitriptyline, nortriptyline, or imipramine may sound familiar because for decades they were standard prescriptions for mood disorders, nerve pain, and even sleep problems. Take Mr. Collins, a 68-year-old retiree. His doctor prescribed amitriptyline years ago to help with chronic back pain. He didn't realize that the very pill easing his pain could also be disturbing the rhythm of his heartbeat. Here's the problem. Tricyclics interfere with the heart's electrical conduction system. They can slow signals, creating irregular rhythms or complete blocks. In younger patients, the body often compensates, but in older adults, especially those with pre-existing heart disease, the margin for error is razor thin. Symptoms like dizziness, fainting, or sudden fatigue may be early warnings, but many ignore them until an emergency strikes. Modern medicine now offers antidepressants that work without such severe cardiac risks. Unfortunately, some patients remain on tricyclics simply because they were started years ago and never reviewed. If you or a loved one is still on one of these older drugs, ask your healthcare provider whether it's time for an updated approach. Next up is pill number 3, a medication so common it's sold in nearly every pharmacy aisle for colds and allergies. Pill number 3, decongestants. Pill number 3 is the decongestant, the tablets and syrups people grab when a cold or allergy blocks their nose. Common ingredients include pseudoephedrine and phenylephrine, which are in dozens of over-the-counter products. Consider Miss Rivera, age 66, who picked up a cold remedy at her local pharmacy. Within an hour, she felt jittery. Her heart was racing, and she couldn't understand why a simple cold medicine made her feel worse than the illness itself. Here's the reason. Decongestants shrink swollen blood vessels in the nose to clear airflow, but they don't stop there. They also tighten blood vessels throughout the body. That constriction can drive blood pressure dangerously high, trigger palpitations, and create feelings of restlessness or anxiety. For someone already on blood pressure medication, the clash can be especially risky. These drugs are often assumed safe because they're sold without a prescription. But for seniors, especially those with hypertension or heart disease, they can be a hidden hazard. Next time you're reaching for a cold remedy, read the label carefully and ask your pharmacist if there's a safer alternative. Up next is pill number 2, one of the world's most prescribed stomach medications, but long-term use can quietly drain the body of key nutrients and weaken the heart. Pill number 2, stomach acid blockers, PPIs. Pill number 2 is the proton pump inhibitor, or PPI. Drugs like omeprazole, lansoprazole, and esomeprazole. They're incredibly common because they provide quick relief from heartburn, reflux, and stomach ulcers. Take Mr. Nguyen, a 71-year-old who had suffered from chronic heartburn. His doctor put him on a PPI, and at first it felt like magic, but after years on the medication, routine blood tests revealed low magnesium and vitamin B12 levels. And soon he began experiencing muscle cramps and irregular heartbeats. Here's what's happening. PPIs reduce stomach acid production, which eases reflux symptoms. But stomach acid also plays a critical role in nutrient absorption. Without it, the body can't efficiently take in magnesium, calcium, or B12. Over time, this deficiency can weaken bones, disrupt nerve function, and destabilize the heart's rhythm. Some studies have even linked long-term PPI use to higher risks of kidney disease and infections. These medications can be life-saving for short bursts, but they were never intended for permanent daily use. If you've been taking them for months or years, talk to your doctor about finding it and fixing the root cause of your reflux rather than masking it. And that brings us to the most important part of our countdown. Pill number 1, the drug that silently puts the greatest strain on the aging heart. Pill number 1, calcium channel blockers. Pill number 1, the drug category that worries me most for older adults, is the calcium channel blocker. These include medications like amlodipine, verapamil, and diltiazem, often prescribed for high blood pressure or chest pain. Let me tell you about Mrs. Thompson, a 74-year-old who came to the clinic complaining of extreme fatigue and swollen legs. She thought it was just part of aging, but after an exam, we discovered her heart rate was dropping far too low, a direct side effect of the calcium channel blocker she'd been taking for years. Here's why it matters. These drugs slow the entry of calcium into heart and blood vessel cells. That relaxes vessels and lowers blood pressure. But it can also reduce the heart's pumping strength, slow its rhythm, and cause fluid retention. When combined with other heart or blood pressure medicines, the effects can stack dangerously, leading to dizziness, fainting, or full-blown heart failure. If you're prescribed one of these, do not stop on your own. That can be even riskier. Instead, talk to your doctor about whether a different medication, dose adjustment, or regular monitoring might be safer for you. Now that we've covered all 7, let's step back and talk about the bigger picture. How to protect yourself without living in constant fear. Wrap up. We've just gone through 7 common pills that can quietly strain the heart. But here's the key takeaway. This isn't about fear. It's about awareness and prevention. Never stop a prescription on your own. Instead, use this knowledge to start a conversation with your doctor. Most of the time, there are safer alternatives, different doses, or ways to monitor side effects before they become emergencies. Remember, protecting your heart isn't just about avoiding danger. It's also about building strength through nutrition, movement, and careful monitoring. That's where simple tools like health trackers can help. By reminding you about medications, logging symptoms, and keeping you one step ahead. Your goal should be confidence, not confusion. With the right information and guidance, you can stay independent, healthy, and heart strong for years to come. If you found this video helpful, please share it with your family or friends, especially anyone caring for aging parents or grandparents. And don't forget to subscribe so you never miss the next heart-saving tip. Take care of yourself, take care of your loved ones, and stay strong at heart.